Welcome, everybody. Thank you so much for taking time out of your day to join us. Um, and thank you for Ryan and the External Affairs team for setting this up. This is great. So what I want to start with is Ryan already did the introduction for me. So I am a veterinarian, and I'm not sure if some of you know what conservation medicine actually is. So I wanted to take a minute to explain that really quickly. So conservation medicine is the study of how people, animals, and the environment are connected. So in relation to my job, I develop and apply health management practices to protect ecosystems and biodiversity. I study the effects of disease on endangered species, and I work to control or at least understand diseases in wildlife populations. The best part is I get to work with other professionals like biologists and hydrologists and ecologists and a bunch of other ists, which really kind of makes my job even that more interesting. So thank you to everybody that's doing work to limit the impact of avian influenza or bird flu and helping to spread the information about the risk. And as Ryan said, I do want to reassure everybody that we have been monitoring bird flu very closely for years. I'm not sure why this is not advancing. All right, here we go. So with all of that, we did, as ICF, thought it would be time to talk about HPAI or bird flu in cranes. This is generally going to be a pretty high level discussion. And as Ryan mentioned, we have developed a fact sheet, which he showed you that. He'll put that in the link for everybody. Plus, it'll be on the slides a couple times throughout this presentation. So what I want to do today in this hour we have is really talk about what is bird flu, how is it impacting bird and crane species, what are we doing, and then what can you do? So hopefully that'll cover a bunch of questions and let you know kind of where we are with managing this disease in relation to cranes. So what is bird flu? So it's also called H5N1, avian influenza, or HPAI. And you've probably heard all of these in different stories, news stories, articles. It's a highly infectious disease from type A influenza virus. It occurs mainly in birds and is spread by waterfowl. And most affected have been poultry flocks until the last couple of years. So the next slide is one of my slides that's going to be a lot more in depth. So I didn't want to overwhelm you by just jumping right into that one, but this is a really nice map. And I want to go over a little bit about the history. So avian influenzas have been around for centuries, and the first description of it dates back to 1878 in northern Italy. In 1955, it was shown that the virus was a type A influenza. In birds, there are two categories of avian influenza A. One is the high pathogenic avian influenza, or HPAI, and the other is low pathogenic avian influenza, or LPAI. Most bird flu viruses are LPAI and cause few or no signs of disease in wild birds, chickens, and other domestic poultry. A few bird flu viruses are HPAI, and the primary impacts, as mentioned, have been historically centered in domestic birds. Since the appearance of H5 type influenzas in East Asia in 1996, a number of outbreaks in poultry during the 2000s and 2010s have occurred. These led to the culling of millions of domestic poultry and economic losses in the US alone counted in the billions of dollars. So a growing number of outbreaks and virus strains have since been described in wild birds worldwide. These have been associated with variations or changes of the H5 virus's genetic material. The map shows the current H5N1 that we're working on. And if you can see in the smallest box where it says H or A/goose/Guangdong, that's the actual official title of the H5N1 influenza. The map on the left is really kind of how the virus has spread globally since it first emerged in 1996. And you'll see those areas and countries that are in the dark gray are countries that this disease has been reported in. The first significant losses in wild birds occurred in central China in 2005, and it involved over 6,000 wild birds of multiple species from the H5N1 strain. Only one pair of black-necked cranes was found among all of the dead birds. At this time, it seemed that the disease was again mostly limited to waterfowl, which are the species that naturally harbor these viruses. It is really important to acknowledge that only a few bird species may play a role in the propagation or the spread of HPAI viruses. Most wild bird species, as well as poultry and other domestic birds, are neither tolerant of the virus or resistant, and thus they become ill and do not move much, which implies that they are poor spreaders, and instead they may act as sentinels of viral circulation. So there's a large number of different avian influenza strains that are constantly in circulation. The good part is most of these are that low pathogenicity avian influenza that you're not going to be hearing about, but some of them are the high path avian influenza or bird flu that we're going to be talking about more today. So I promise there's not too many maps, but this is the last one I have. So the one that right now that we're hearing a lot about is classified again as that H5N1. And then this can be subdivided further. It was first detected in Eurasia, as those maps shows, and then spread to the Atlantic coast of North America. And then as we have been seeing, this is causing more and more severe disease and high mortality in infected poultry and wild bird species. Since 2006, the new variants of H5N1 have become more lethal to wild birds with sustained transmission between migratory waterfowl, suggesting that the virus could be carried along migratory routes. And then we started seeing signs of the current bird pandemic from avian influenza in 2021, and it has continued to persist through the present day around the globe. In the last 2 years, the virus has mutated to not just affect domestic poultry and wild birds, but also carnivores that eat infected bird carcasses. In late 2023 and early 2024, lactating dairy cows in the US and the cats and mice found on those farms were infected by a different strain of the same avian influenza and are another source of risk. And the thing to keep in mind too is avian bird flu, avian influenza is a zoonotic disease. And so that means that the disease can jump from animals to people. And we're seeing that already in the carnivores and cattle. There have been human cases reported in people are humans, that work with domestic poultry and dairy cattle during an outbreak, but these people have recovered from the virus. The first report of a human death occurred in Louisiana just this past December, in December 2024. The other things to know about this virus is that it's very cold hardy, which means it survives in cold weathers. And so more cases tend to be seen in colder months around the world. It can also remain viable or live in water, soil, and feces for over 30 days. Cold months are also when wild birds start migrating and can carry the diseases to new populations of both birds and mammals. And at this point, I wanted to bring up some of the signs that we see of HPAI or avian influenza and waterfowl and other bird species. These include most frequently sudden death, because this is a really fast-acting disease. Neurologic impairments, and that really, neurologic, think of things that go with the brain. So lack of coordination, spinning in circles. You'll see sometimes a weird posture with a twisted neck or tremors. The birds will have a lack of energy and appetite. Some birds get swelling of the head and neck and around the eyes. And some birds will also show nasal discharge, cough, sneezing, and diarrhea, as you see in some other of the influenza type diseases. The virus is spread by feces most commonly and is less common by respiratory secretions or respiratory fluids. Again, most of them die, which is really sad and unfortunate, and there's really no cure or treatment for this disease except for supportive care. But again, most of them are dying before they even get to a place where they can be treated. So signs of dairy cattle, because it is stirfront, include a drop in milk production, which is important for agricultural purposes, an abnormal appearance of the milk, weight loss with reduced appetite, fever, diarrhea, and then it gets some nasal just discharge and respiratory signs. The thing that's different with the cattle virus is it's spread by milk from lactating cows. And the good part, at least right now with the cows, is that most of them recover, but they may never return to their full normal milk production levels they had before the virus. The nice thing about the cattle virus is that pasteurization, which is heat treatment of milk, has been shown to make the virus inactive. So this type of milk remains safe to consume. I want to make sure I pointed that out in this lecture so you weren't worried too much about milk. Okay, and then kind of moving back to cranes and some of the bird species. Just a quick review of what we've seen recently. So in 2021 and 2022, avian influenza hit the Izumi Plain in Kagoshima, Japan. This is a wintering ground for more than 12,000 endangered cranes, both the hooded crane and white-naped cranes. The site is also visited by wild ducks and had a thriving poultry industry adjacent to the crane roost and conservation sites. During this outbreak, over 8,000 cranes were killed, in addition to other bird species. At the same time of the year, over 5,000 common or Eurasian cranes were killed in the Hula Valley in Israel, as well as a high mortality of demoiselle cranes in India. In the winter of 2023, an estimated 10,000 Eurasian cranes were killed in Hungary. What's common about all of these locations is that they had artificially concentrated areas of birds. Artificially concentrated means really that more birds are found in these areas than would occur normally on wintering or migration staging sites. These birds are offered rice or other grains to attract birds for tourism or to provide an alternate feeding site away from farmers' agricultural fields. During these times, since there were only other scattered reports of individual birds in other crane species dying in small numbers, even in areas where large number of other bird species were dying. So at that point, we weren't as concerned about naturally occurring by bird congregations, as you would see on wintering grounds or again, the migration staging sites. In natural situations, the birds can also move away from each other and they spread out and generally can reduce their stress from a lot of birds in one area. In these artificially condensed flocks, the food motivation is high enough that birds will endure being much more closely packed to each other, but you certainly see levels of increased stress in these birds in these artificially concentrated areas. In other bird species, so not cranes, because this is not a disease of cranes, it's a disease of every bird species, mass mortalities have occurred at breeding grounds and other areas where there is no reported artificial congregations. The true numbers of deaths have been difficult to monitor for wild populations, either through remoteness of the colonies, individual countries' decisions to report, and transparency of testing results. Teams of biologists and other agencies who work with migrating shorebird or waterfowl have been very helpful in providing details to the global community that work with these types of species. And there's currently some plans to create notification networks within flyways and between at-risk sites where are often where cranes are found. The numbers in the poultry industry, on the other side, are much easier to determine. So the current number of poultry that have been culled in the US alone to try to limit individual bird suffering during the rapid course of disease and prevent spread has been over 20 20 million just in the last quarter of 2024, when the most recent season began. So this bird pandemic, this avian influenza, is very scary for so many different reasons. And hopefully you're starting to kind of get a picture of some of the impacts that we've been watching. So this is just a quick content warning for the next slide. I do have some pictures of dead birds, so I wanted to give you a heads up. I won't be on it that long, so if you want to look away, I will announce the slide after this following one. So here's what things changed. So in January of this year, we received reports of demoiselle cranes dying again in India. 33 total reported so far, but likely much higher. And closer to home, it is now being found in sandhill cranes in Indiana, Kentucky, Tennessee, and Florida, and appears to be quickly spreading through the eastern migratory population. The eastern migratory population covers northern Canada and then basically along the Mississippi River Basin, for a rough guide if you're not familiar with it. As with all these flocks, there are endangered and vulnerable species integrated into the flocks, which don't have the large population numbers to be able to offset large mortality events. The good news as of today is that no whooping cranes have been reported to have been ill or found dead. This is one of the most closely monitored species in the US, and with all birds having some form of telemetry to follow their locations. We also have volunteers monitoring the whooping cranes along their migration routes within the eastern migratory population and on their wintering grounds. So the higher level of concern that we have is that the sandhill cranes are not artificially concentrated, as we have seen with other mass mortalities. The situation in the Midwest is still unfolding, and we are very closely monitoring it and trying to be prepared ahead of its arrival, but it is hard to know the current viral loads and how many birds are actually dying. Almost all of the outbreaks and cases are underreported for a variety of reasons, including not testing all the birds that are found dead. There are also reports of a new H5N1 that appeared late last year and has been moving east from the US West Coast. It is reported to be more infectious with a higher mortality rate in wild birds. So I'm unsure if this is the cause for the sandhill crane deaths, as these reports really started just within the last week, and we don't have the specifics of the type of H5N1 that is affecting the sandhill cranes. So if you looked away, I'm moving on to the next slide, so please rejoin us. And then this is the last really big kind of nerdy map that I wanted to share with you. And then I know the focus, because we're International Crane Foundation, is about cranes. But I also wanted to share this map that was just published in January of this year. So there's a multitude of other common and endangered species that are being affected by this virus. Again, it is not a virus that only affects cranes. You've heard about it in poultry, and I just want to reemphasize that it can affect any bird species. The US, Europe, and Japan have the most robust reporting, which is why it appears that there is more virus in these countries. I honestly, though, would guess that the same scenario is playing out throughout the globe, mostly in the upper northern and the lower southern hemispheres, which makes this map even more scary because it's not catching all of the cases that are actually occurring. Okay, so AHPAI, or avian influenza, is a very global mission for us here at International Crane Foundation. It requires worldwide collaboration on everything from forward-looking planning about land, feeding strategies, crop damage, tourism, and other things where cranes are living to reduce these bird concentrations. In Izumi, Japan, they have stopped the feeding for the artificial concentration, and now only about 50% of the wintering cranes that used to go there are appearing at that site, and the other 50% have shifted to Suncheon, South Korea. Apologize if I mispronounced that. Cranes also live in high disease transmission wetland areas, and working at these sites will also improve land and water for a multitude of other species. All right, one more quick content warning for the next slide. Again, I will let you know when I've moved off that slide if you don't want to see. The other thing we do here at ICF is we provide emergency hazard response assistance during die-offs, which includes funds for human PPE or personal protective equipment and salaries for workers. One of the biggest things that we're finding is that in addition to separating those flocks and not having them artificially concentrated, is to remove the dead carcasses. Just so that you're getting that disease out of that environment. And that has been shown to be one of the really big steps in trying to mitigate this disease. All right, so I'm stepping off of that slide if you want to join us again. And then the third thing is that we have the specialized vet team that I'm the director of that works with our cranes to keep them healthy through preventative health programs and exams. We also keep the birds in our care safe through the use of biosecurity plans. And biosecurity is a way of keeping pathogens away from the birds in our care through awareness of potential areas of risk for disease introduction. This includes drawing down or draining ponds to limit waterfowl visitations, moving birds to covered or netted enclosures so other wild birds cannot join them in their space. Reducing options for virus transfer from our field sites around Wisconsin and around the world. Reducing options. And then quarantining areas. So if we're finding disease in a field area that we're working at, we'll slow down or change how we approach that area, or we'll stop doing research in that area. And the same as if the virus is getting closer and closer to our headquarters breeding facilities here in Baraboo, is that we start restricting more and more of access to the birds so that we're limiting more of their exposure. And then we also use dedicated footwear and foot baths to limit disease transmissions actually into our exhibits and our breeding facilities so the cranes continue to receive good care throughout this season. And it's not just us, but all zoos have biosecurity plans in these seasons of high disease. And most of them have the ability to scale up or to scale down their response based on the proximity of reported avian influenza cases. And I think I've stressed it, but I want to just make sure that I hit it again, is that the mortality rate is extremely high in all susceptible species, and there's no good care aside from supportive care for these birds. As a veterinarian, I have also pledged to keep both animals and humans safe, and treating sick birds comes at a risk to humans, and the recovery rate at this point is nearly zero. In poultry, they can be exposed and die within 48 hours, and in the bird cases that I've seen, the timeline is very similar. Kind of a wrap up for at least the medical side of this is prevention is really key. And we look through all the areas where we can limit our risks. Some of you may be thinking and are asking about vaccines, and there is a veterinary vaccine that is being developed for poultry and cattle, but it is not yet finished, and we are unsure if it will be available for non-agricultural species due to trade and cross-boundary considerations. So more to come on that one. ICF is currently not open to the public for our winter season, but we will have our birds and visitors' safety in mind as we get ready to open later in the spring. We are constantly evaluating the risks despite delayed or absent reporting for disease detections across the US and the globe. We have an excellent relationship with our state wildlife agencies, as well as numerous other colleagues, both locally and around the world, to help keep us informed. So the next question is, what can you do? So again, here's that link that Ryan shared earlier about some information that we have on our website. And I think I forgot to say that I'm back away from the scarier picture. So if you haven't rejoined us, please do. And the things that are really important to think about what you can do is report any dead or sick birds to your state Department of Natural Resources or the similar type of agency in your state. Really important is don't touch or handle any dead birds unless you have been trained how to do that to keep yourself safe. If you go to sites where there are large numbers of ducks, geese, poultry, or birds, clean your shoes and wash your car. And one of the things that we're learning here, or we kind of have caught as a catchphrase, is don't be a fomite. And what a fomite is it's an inanimate object like your shoes or your car that can carry disease from one place to another. And remember when I said that this virus lives in dirt and soil and water and feces for over 30 days. So if those things are contaminated, you're going to be transferring the virus. And what you really want to do, again, is just make sure that you've got all the debris off of your shoes. And if you can use different shoes for different environments, that's even better. So our slogan here is don't become a fomite. So that's one thing to remember. And then just please be careful if you work with poultry, if you hunt ducks or have large groups of waterfowl on your property, because that is a little bit higher risk based on the amount of disease that we're seeing in those species. So the other question we've been getting is, what about birding and bird feeders? So we really don't know the role that songbirds play in avian influenza and this outbreak. The recent plans that came out in the paper in the last 2 or 3 days to remove non-native European starlings at dairy farms in Nevada haven't shared whether the starlings have tested positive and are acting either as a carrier or are infected. They do mass in large numbers, and they can cause some sanitary questions, but it's still not known and not published yet whether they actually can transmit HPAI or avian influenza. And then the information that we'll share from the Audubon Society is that for bird feeders, we're recommending observing birds in yards and at a bird feeders at a safe distance and checking regularly with your local, state, or federal wildlife agencies and see what they're recommending for when wild bird feeders should be taken down. Audubon recommends that if at least one of your local agencies indicates to take down feeders, we also recommend removing them. In the meantime, we also suggest following the recommendations of the CDC and other regional health authorities to follow general guidelines and avoid, again, touching dead birds. That's where your highest risk is. So if you're seeing birds coming in and you have backyard poultry, which I know a lot of people do, the one things that you want to start thinking about is how to protect your poultry. So in cases where you're seeing a lot of dead birds, move the chickens or your ducks underneath a roof where they cannot have wild bird feces that drop in on them. Don't let them run around where wild birds have defecated. That's really high risk. And then if you can, wear dedicated shoes just to take care of your backyard birds, backyard poultry, your ducks, and do your best to keep those shoes out of your house and separate from shoes you would wear to go hiking, running, or anywhere else that you would see a large number of waterfowl or shorebirds. If any of your birds get sick, please call your veterinarian or state agricultural office. And then please also know that if your hen is sick, the egg will have virus on both the shell and inside the egg. None of this is meant to scare you or panic you, but it's just to make sure that you have information and you can protect yourself. So thank you very much for joining us today. Your support matters tremendously. Again, the website link is on this page. And then the best way to make sure that we have the tools to handle emergencies like avian influenza across the globe is to become a member or donate. Our work for cranes also helps so many other bird species that share their habitats. Again, thank you very much. I hope this answers some questions about how we are watching out for cranes, both at our breeding facility here and exhibit facility here in Baraboo and for the crane populations around the world. Again, thank you very much.
Thanks, Diana. And we do have a few questions if you're okay to answer a few. First one is from Bill Richards and is asking, and you might want to stop sharing your screen there, is asking, what do you use to clean your shoes? And maybe you could also elaborate on cleaning your vehicles if you go into avian influenza areas.
Yeah, that's a great question. So Dawn detergent is a great first step to kind of like use a brush if you need to and really get some of the dirt out of there, and then use Dawn and it'll break up greases and fats, and it's just a really good gentle cleanser and make sure all that mud is out of your shoes. If you have something that you can use that you're really concerned or you've been wearing waders, I would also disinfect them with a bleach solution. And the CDC, I believe, is recommending a 5% bleach solution, but it would be worth checking on their site for different concentrations of bleach so you don't have to use it full strength. In terms of the car, when I was talking to USDA inspectors, they really said that the best thing to do was just run it through a car wash. Because really where the problem is and wherever the virus lives on the cars is in the wheel wells. If you've driven on the highway, excuse me, the heat of the road and the rubber is going to get rid of the virus actually on the tires, but it's the wheel wells, excuse me, that will trap that virus. So make sure you wash it under the car. Excuse me. Hopefully that answers the question.
Thanks, Diana. We have a question here. Can you elaborate a little bit more on how the International Crane Foundation determines to upgrade its threat level, and how do we decide whether or not to have birds on exhibit at our global headquarters?
Yeah, that's you guys have some great questions. So excuse me if something caught in my throat. So we really have 4 stages, and one of them is the first one is stage 1, and that's normal operations that we know that the virus has been reported in the country, since we're a pretty large country, but not yet near Wisconsin. Stage 2 would be that it's reported within Wisconsin. Stage 3 is that it's within Sauk County, which is where Baraboo is. And stage 4 is actually we've detected it on grounds, either through wild birds or birds in the collection. Because of some of the changes with the reporting, we've been hearing a lot that we're seeing cases more frequently in the state. So we've actually kind of bumped up, and we're like right now between a level 2 where we know it's in Wisconsin, but we don't know exactly which county it is closest to Sauk, so that we're kind of balancing all of that information to determine where we are in terms of our care. And then again, this is such an ever evolving status of the disease that we're reassessing weekly to see, do we need to change something? Do we need to increase or decrease our levels of biosecurity? And then as it gets closer and closer to opening in the spring, we'll have a better idea of really what we're doing. But all of it is really to have less and less chance that the risk is going to come close to any of our birds. And again, hopefully that answered the question. If it doesn't, I can elaborate further.
Great, thanks. And Diana, I'll take this one while you clear your throat there. Sounds like
Thank
you got a frog down there.
I do.
So we have a question about resources, and we put together this really great page. Again, that's at www.savingcranes.org slash avian dash influenza. And the question was, where do you find your local agency in charge of this? And if you scroll all the way to the bottom of that page, which is also linked in the chat, if you pull that up, there is a table with as many state agency resources that we could find for each state. So that's broken down by the Department of Agriculture or related, the Department of Natural Resources, and the Department of Public Health. So hopefully you can find the resource there you're looking for, but most times it seems that the Departments of Natural Resources are where you would go and report a bird mortality. Diana, we have another question here. Can the virus be transported by waterways and soil?
Yeah, so that's that is another great question. And yes, and there have been some papers coming out about how long it's surviving in these different types of waterways. And if you think of a lot of it as the fecal contamination from ducks, shorebirds, cranes, any of the birds that are visiting those are going to be captured in those soils. And, and that's the really tricky part about this virus is that it actually kind of likes the cold. It does really well. It's not killed by cold. It's not killed by water. So it can be carried. It can be found in waterways. I have only seen papers on wetlands where it doesn't have the big free-flowing bodies of waters like rivers. I've only seen it in more of the quiet waters that you would find at some of these high-risk sites that a lot of the birds are spending time at.
Great. If a bird seems healthy but then dies, is that a concern? And after dead, would it still be a carrier?
Yeah, so the biggest problem with this disease is it's so fast and species that are susceptible to it. So some of the reports, this is a little graphic, my apologies, that they saw birds flying and they just fell out of the air. So it can be that fast. And birds are so good about hiding viruses that may be how you actually see them present. And yes, that virus is still present in that body and that body is still infective. And so that's one of the reasons that we're like, if you're not trained to handle dead bodies to protect yourself, just don't touch them because there is a really high risk that they are carrying a pretty high viral load. And then in the poultry industry, what they're recommending is burial, incineration, or the other ones, I don't want to put out there for general, but they also recommend composting, but it's not your backyard composting. It's a very industrial type composting, but it's high heat things. They're the best ways to kind of inactivate the virus and make it safer.
Great. And there's quite a few crane festivals coming up. There is the Marsh Madness Sandhill Crane Festival in Indiana this weekend, and then there's the Whooping Crane Festival down in Texas later this month. For folks traveling to those areas, either coming to an infected area or coming from, and of course we don't know exactly where all the infected areas are. Can you reiterate how people should be caring for their clothes and taking other precautions and what they need to worry about going to those quote unquote infected areas?
Yeah, great. Again, another great question. So again, goes back to the car. So the first thing, think about your car. And if you're coming out of those areas, you've parked in dirt parking lots where you see bird feces or you see ducks or geese or other bird species, definitely wash your car coming out of that. If you've been somewhere and you don't know, you could just wash your car before you go into any of these areas where these festivals are happening. And in regard to yourself, it would be great if you had 2 changes of shoes. So you had one that you could actually wear on site. And then you can put those in a plastic bag or a bin or something can also keep your car clean. And then change to a fresh pair of shoes that don't go anywhere near the refuge. If you are actually in the water and you've got water contact or you have waders and they leak, I would just do a whole full change of clothing so that you're as protected as possible. And again, thinking about, what can I touch or what could I touch that it might contaminate. So think about keeping your car as clean as possible and having a bin or bags to put in any of the contaminated clothing. Because we still want you to go birding. We still want you to be able to enjoy cranes and all the other species. But you definitely have one of the things you can do is help protect them too by a lot of those steps and mitigations for getting everything that you might be bringing to those areas clean.
Great. Let me see. We just had a few more come in here. What about Canada geese and wild turkeys?
I haven't seen a ton of reports on wild turkeys, but I would suspect that they're really sensitive to this disease. And then Canada geese also, have been reports, a lot of reports that of Canada geese that have died because of this virus. So they are ones that can potentially contaminate an area pretty well.
I saw that we have a note here. I saw that there were a large die-off of ducks on Lake Michigan. Was that avian influenza?
That was avian influenza. And you may have also seen that Milwaukee County Zoo, because of their biosecurity plan, has closed the aviaries that people walk through to protect their birds. But yes, that was an avian influenza die-off.
Where are your birds in the winter at ICF that they're protected from this?
Yeah, another great question. So we have the breeding facility, or Crane City, that's behind the exhibit area. Next time you're visiting, there's an overlook and you can kind of look down to that area. All those birds are under nets. And there's not a lot of places for birds to perch on those nets. In between we call them streets. So in between the different houses that all these birds have, we have things to discourage wild cranes coming to visit and wild waterfowl. And then there's currently no ponds in any of those areas. So again, it's really kind of dissuading any wild birds visiting that area. Most of the birds are out of the exhibit area, and they're in their winter homes down in Crane City. The few that are still up there are under netting. So again, that they are protected from birds actually interacting with them as much as possible.
Great. And last question for you, Diana. We have one that is asking, what's the best way to support this work that ICF is doing?
Yeah, the best way is become a member. You get to see all the 15 species of cranes. If you haven't seen already, you can donate, and you can donate generally to ICF, or you can donate specifically to things that you're interested in. And then also, it's just taking care of yourselves and being aware of how you are interacting with birds that are in the wild and their habitats. But again, becoming a member is great. We have a lot of really great things here, and we would love to see you at our facilities here.
Great. Thank you so much, everybody, for joining us. That concludes this webinar, but the recording will be available again on that resource page, www.savingcranes.org/avian-influenza. Be sure to check it out. Thanks so much.
Thanks, everybody.